Okay, I'm gonna talk about some of the risk factors for breast cancer. Okay, let's first talk about the factors that decrease the risk of the breast cancer. So we have the principle that the amount of estrogen that you are exposed to during your whole life is basically going to increase the amount of breast cancer risk that you will have. So more estrogen, more risk. Okay, so if you get pregnant earlier, during pregnancy you are less exposed to estrogen, so more pregnancy and earlier pregnancy exposes you to less estrogen during your menstruating age. Okay, prolonged breastfeeding. Okay, breastfeeding in general, if you breastfeed your child and if you breastfeed for longer, okay, for the whole amount of the months that is for the child, that will help to reduce the amount of estrogen. Weight loss goes the same way. Less androgens, less estrogen being made in the body, avoidance of any medications or any supplements or any herbal ingredients or anything that can increase the amount of estrogen that you make. So reduce your fat in your diet, reduce the amount of weight. That's basically going to help to reduce estrogen in the blood. Okay, now for the risk factors themselves, gender, of course, females have a higher risk for developing breast cancer, although it is important to mention that breast cancer can happen in male individuals and it accounts for 0.5 to 1%. Say 1 out of every 100 people who have breast cancer is a man. Okay, age. So with age, of course, the more older you are, okay, the older you are, the more likely that you will have breast cancer, okay, or present with breast cancer. The lifetime exposure to estrogen, so that will be something like early menarche and late menopause. So if you have earlier menarche, you start your menstruating age at an earlier phase and you stop menstruating at a later age. That basically is the exposure to estrogen more, which is the principle that we have. And nulliparity versus late first pregnancy, specifically the age of 35, if you want to remember it. Generally, the numbers don't matter that much, but the idea is less estrogen exposure or more estrogen exposure increases the risk. Okay, breastfeeding, as we've mentioned, exogenous hormonal therapy, whether you're using those hormones for menopausal age and reducing the menopausal symptoms, or you're using estrogen pills as a contraceptive, those things basically will increase the risk. Genetic inheritance is a very important factor, and it goes into the BRCA and the other genes. Another thing to mention there is a first degree relative. Okay, if you have a first degree relative started at a young age, or any relative, multiple cancers, breast cancer, having cancer at a young age, these things will increase the risk of breast cancer. Okay, and then environmental. there is no proof yet that there are environmental contaminants that, can actually increase the risk of breast cancer, but they do have an estrogenic effect that can increase or probably will increase the breast cancer. So if you use plastic bottles, or if you use anything that contains some of those materials that increase the amount of estrogen that is made in the body, something that does not need any evidence really, a high radiation exposure will increase the breast cancer risk. Yeah, that totally is true, because you're basically changing the DNA at the cellular level, at the nuclear level, and that basically is the principle for many cancers. Lifestyle factors. So postmenopausal obesity, okay, or obesity in general, physical inactivity, and alcohol. I think that alcohol is also related to estrogen. Anyway, that's it. We didn't really delve too much into the genetic factors with the BRCA genes and everything else, but that is going to be for another time.